You are watching the Doctalk show.
So welcome back from the break. And joining us is yet another specialist, Dr. Chris Nolile. Dr. Chris Nolile is a senior lecturer in Makerere University in the ENT department and is heading the collaboration between Makerere University and New York University and is working with TMR Hospital to advance care related to hearing loss in the country. Welcome, Dr. Nolile.
Thank you. Glad to be here again.
And we're glad to host you. Tell us, Chris, what is hearing loss? Is it any different from deafness as we have known it?
True, hearing loss is failure to perceive sound, whatever sound it is. It goes from mild to severe. We don't normally want to use the word deafness because it's attached with this some stigmata. But when you're severely impaired, like you don't have any constructive sound that you perceive, then we call you deaf, as in quote. That's what the community will call you. But as scientists who deal with hearing, we tend to call it hearing loss, and we know it can range from mild, moderate, severe, and even profound. So that's what we call hearing loss, just failure to perceive sound, which is very essential to our day-to-day life because we live in sound.
Is this a problem that is common in Uganda? Do we need to know about hearing loss?
It's bigger than a problem. You see, when you have a problem and nobody knows about it, it becomes slightly bigger. So with hearing loss, you have a silent epidemic. It's below, like at the tip of the iceberg. Nobody sees, you don't care about it. But it's under the sea and it's brewing and brewing and brewing. So it is what you would call a silent epidemic. And if not tackled quickly and we try to create lots of awareness, then at one point in time we are going to find that many of us cannot comprehend what we are speaking, and then we shall become less productive. Statistically, almost 1 in 1,000 children born in this country will have some kind of hearing loss. So if you take about 40 million in this country and you divide by 1,000, you can get a figure of how many people are actually suffering this kind of hearing loss. True, we are a low-income country, and some problems tend to get bigger with the economics of where you stay. So much as we say 1 in 1,000, that is the statement, but because of our economic status and all the social things that run with this country, you will tend to find that the hearing problem is slightly higher.
So how do we tell that one could be having problems with hearing loss? Professor McMahon.
Well, we identify it in the very young children with screening. Hopefully every child, as we said in the first segment, is screened at birth for the presence of hearing loss. We talk about milestones. Children should be developing speech. We know at what age this should occur, and if that doesn't happen, immediately hearing should be tested. And once you become a young adult or an adolescent or an adult, if you begin to notice your hearing declining, then we would recommend getting a hearing test. There are different types of hearing loss, and our treatment needs to be aimed at the particular type of hearing loss that a patient may develop, whether it's hearing aids, whether it's ear surgery, or whether it's a cochlear implant.
Is there any benefit, Professor Roland, in determining the hearing loss early enough? Does it help?
Oh, yes. No matter what type of hearing loss one has, the management of that hearing loss is most effective the earlier that you detect it and the earlier that you begin to treat the hearing loss. So a child who's going to get a cochlear implant, the earlier we can give them the cochlear implant, once we've made the diagnosis of hearing loss, the better they will do, and the less hard work they'll have to do over those early years to get to a level of other children. The goal is to have every child mainstream in school with appropriately managed hearing loss, and that doesn't happen many times. It's a bigger disability in this country and in every country than one thinks, and the World Health Organization recognizes hearing loss as a major disability in both resource poor and resource rich countries.
How are we going to make sure that we get our children tested early enough, or even the older patients, that they come early enough? Any strategies you think that we can adopt as a country?
Yes. There are lots of proposals, and these proposals, once in place, should help us get this problem sorted. Currently, what is happening, there are few testing centers in the country. It's not widespread, but you can have a test at Mulago, Makerere University Medical, the hospital. You can have tests in KCC. Is a voluntary organization that is helping testing children, and it's in Chisenyi, so they are doing some work. Some private people, one or two, are helping test children. And I think at Mbara University, they also have some testing facilities. So if those few kind of facilities within the country, that's why we say that there is a silent problem, and we need to tackle it as a huge mass, you know, like the country. It would be my great idea for this country to put testing gadgets or carry out hearing tests. For example, I think one of the successes of this country is immunization. I don't know the figures, but I know it's people go and immunize. And one of the proposals that we have is try to put a hearing test, maybe screening hearing test at maybe a regional referral or a district hospital for starters as a pilot. That will increase the number of people we can catch, as in the pediatric population. For adults, the normal way of identifying that you have a hearing loss to go for a test, you have less productivity. You know, you start not hear, you have so many pardons. If you are with your boss, you're messing up stuff. So it creates a lot of social problems with you. And then you could see an ENT doctor. Testing in adults and children is slightly or totally different. So for adults, it's easy, and the tests are readily available. You know, they are easily found, and they are not as hard as for those of children.
Which brings me to the next question. We fear the ear so much. It seems to hurt, even with a little poke. Are your tests harmful? Should we fear, especially for the children or those other patients?
No, they are not harmful. They are just simple tests. We put, like, you're hearing headphones on your head, and then we send simple sounds which we expect you to respond to. And then if you don't, then you have a problem, and you can have problem at mild level, moderate, or severe level. That's for adults. For children, it's slightly different. We need an objective test, because the child will not tell you that, yeah, I've had this test. No. So we test the pathway from the brain, from the time the ear sends the signal to the brain, so that interface. So we put some small electrodes. They are also not painful. And technology has gone so far that we could do this test with the mother carrying the baby, could slightly sedate the baby or put them to sleep, depending on the characteristics of the baby. But they are not painful, and they are very safe.
It's been thought that treating hearing impairment is actually very expensive. Are all the options expensive? Do we have all of them available here in Uganda? Can a small country like ours, Professor McManamy, be able to manage the burden of people that are having hearing problems?
Well, It is expensive. I think what has to happen is the country has to make it a priority to diagnose children with hearing loss and then help the families get the appropriate treatment, whether it's a hearing aid, whether it's a cochlear implant, no matter what it is. As Dr. Rowland said, the earlier we make the diagnosis, the earlier we begin treatment, the better that child or patient will do. So I think what has to happen is, has to be recognized, as Dr. Chris said, that it is a real healthcare issue, and then we have to get the government to act on that priority.
Thank you. So I'm inviting all of you to prevent hearing loss. We recently had immunization, very good response, and among the diseases that we are preventing was rubella. And we know rubella is one of the causes of deafness, especially in children. So I'm inviting you, join the national campaign to immunize against rubella and measles and all these problems that can actually cause hearing loss. Doing that, we shall prevent hearing loss and save our children and give them a bright future. As you go for the break, don't forget to follow us on Twitter, subscribe to our YouTube channel, and like us on Facebook. Your questions are welcome. Our team of experts will be ready to respond.
You are watching the Doctalk Show.